There is something that stays hidden in most long-term relationships, not because the people involved do not care about each other, but because no one ever laid it out plainly. Most men carry a genuine blind spot about what their partner is actually going through during the most intimate moments they share. They are not indifferent. If anything, they care deeply. But caring is not the same as understanding. And without a clear clinical picture of what unfolds in a woman's body and mind during intimacy, especially in the moments surrounding penetration, that care can fall short of what the moment actually requires. That gap between intention and impact tends to be quiet. It does not usually announce itself as conflict or crisis. It builds slowly, through small mismatches in timing, in attention, in pace, in presence. And over time, those mismatches create a ceiling on what the intimate experience could be for both people. What follows is an attempt to remove that ceiling entirely by walking through what is genuinely happening, physiologically, neurochemically, and psychologically during intimate connection, and what that understanding means for how a man can actually show up when it matters most. To make sense of what a woman experiences during penetration, you first have to understand the state her body needs to arrive in before that moment occurs. Because penetration in a body that has gone through the complete arousal sequence is an entirely different experience from penetration in a body that has not. The gap between those two experiences is not minor. Female arousal follows a specific physiological pathway that takes time and cannot be compressed without cost. It begins in the brain. The nervous system initiates the process in response to emotional, psychological, or physical input, usually some combination of all three. Once that process starts, the parasympathetic branch of the autonomic nervous system drives increased blood flow into the pelvic region. And that vascular response is what sets everything else in motion. As blood flow builds, the clitoral complex becomes engorged. This is not just the small external structure most people are familiar with. It includes the internal architecture of the crura and vestibular bulbs that extend along the vaginal canal. That engorgement dramatically heightens the sensitivity of every nerve ending in the area. The vestibular bulbs, which run along both sides of the vaginal opening and walls, expand and create a heightened, narrowed quality of sensation at the entrance. The vaginal walls begin producing lubrication through a process where increased blood pressure pushes fluid through the vascular tissue surrounding them. That lubrication is both a signal of arousal and a functional requirement for penetration to feel comfortable rather than painful. At the same time, something called vaginal tenting takes place. The upper portion of the vaginal canal lengthens and opens inward, the uterus lifts slightly, and the cervix moves away from the vaginal opening. This matters enormously. Without that tenting, deep penetration brings the penis into contact with the cervix, which for the majority of women registers anywhere from discomfort to genuine pain. Meanwhile, the pelvic floor muscles, which in their ordinary resting state hold a degree of protective tension, gradually release as arousal deepens. That release is what allows the vaginal opening to soften and widen so that penetration feels welcoming rather than resistant. That pelvic floor release is not something a woman can will into happening. It requires the specific neurological conditions that only full, unhurried arousal produces. A woman who is physically present but not yet emotionally settled, or who is genuinely aroused but has been moved toward penetration before the process has run its course, will not have released that muscular tension fully, no matter how willing she appears from the outside. Her body has not yet received the internal signal that it is safe and ready to be completely open. This is why emotional safety is not simply a relational nicety. It functions as a physiological requirement. For a woman to arrive at the state of full engorgement, lubrication, tenting, and pelvic release, the process typically takes somewhere between 15 and 45 minutes of appropriate stimulation. And that window tends to expand rather than contract with age. Hormonal shifts that accompany menopause affect the speed and completeness of arousal, generally requiring more time rather than less, and often making deliberate use of lubrication helpful regardless of arousal level. When penetration happens before that preparation is complete, every dimension of the experience is affected. The vaginal walls are less sensitized. The depth of penetration causes discomfort because tenting has not fully occurred. The pelvic floor has not released, making the physical act feel resistant. And the neurochemical state that produces the full richness of intimate sensation has not reached the level it needs to be at for any of the most pleasurable signals to activate completely. For men who feel urgency around maintaining an erection or anxiety that the physical window might close, that pressure often pushes them toward penetration before her body has finished its preparation. That rush does not just affect the comfort of the experience, it directly limits the pleasure she is capable of feeling in that encounter. The time invested in full arousal is not a preliminary stage before something more important happens. It is part of the experience itself, the part that determines whether what follows reaches its potential or merely passes. When penetration does occur in a body that has been fully prepared, the neurological experience is rich in ways that are rarely explained to men. The initial moment of entry activates the dense nerve endings at the vaginal entrance and the engorged vestibular bulbs simultaneously. Those bulbs, having filled with blood through the arousal process, are pressed against the vaginal walls from inside, which means that penetration creates indirect stimulation of the internal clitoral complex from within, in addition to whatever direct external stimulation may be present. This is why the sensation of penetration in a fully aroused woman is qualitatively different from and considerably more intense than penetration in a woman who has not yet completed that process. The nerve structures most responsible for generating intense sensation are only fully activated and engaged after full arousal. The sense of fullness and pressure that women describe during penetration is not simply a mechanical observation. It is a neurological event produced by the simultaneous engagement of multiple nerve pathways throughout the vaginal canal and pelvic floor. The result is a distributed, deep sensory experience that is qualitatively different from the localized, surface-level intensity of external stimulation. Many women describe it as grounding, something that settles and centers, rather than excites in the more surface way that external touch does. From a neurochemical standpoint, penetration during a desired, emotionally connected encounter triggers a surge of oxytocin. That is the neurochemical most closely tied to feelings of trust, safety, closeness, and profound emotional bonding. Its release in this moment is not poetic language. It is a documented biological event that produces a specific emotional state, a felt sense of being genuinely met by another person, of the space between two separate individuals closing in a way that feels simultaneously physical and emotionally complete. This is why the emotional quality of the encounter shapes the physical experience so directly. Oxytocin release is amplified by genuine emotional safety and real connection. When she trusts the person she is with, when she feels authentically desired rather than simply used, when the relational environment is characterized by care and attunement, the neurochemical experience of penetration in that context is substantially richer than the same physical act would be in an emotionally cold or disconnected setting. The practical consequence is that emotional presence during intimacy is not separate from her physical experience of it. It is a direct input into it. A man who is genuinely present, genuinely attentive, and genuinely invested in her experience creates physiological conditions in her body through the amplification of oxytocin and the sustained activation of her parasympathetic nervous system that produce considerably more pleasurable sensation than the identical physical acts performed with distraction, hurry, or self-focus. There is one more dimension to consider, and it may be the one that changes a man's understanding most profoundly. The moment of penetration asks something of a woman that has no equivalent in the male experience. To be entered by another person requires a degree of physical and psychological openness that means the body itself has to choose to be permeable rather than defended. The pelvic floor muscles, whose natural function is protective, have to fully release. That does not happen involuntarily in the absence of genuine trust. The body knows the difference between safety and its absence. For women in their 50s and 60s who often carry an additional awareness of the physical changes that come with aging, that layer of vulnerability is more consciously present than it may have been in earlier decades. The degree to which she feels genuinely and specifically desired by her partner in this body at this age is directly relevant to how completely her nervous system can open. Cultural messages that suggest aging bodies are less worthy of intimate attention are absorbed quietly and live in the background of how a woman experiences being seen. When her partner approaches her with genuine, specific, expressed desire for who she actually is right now, the effect on her nervous system is substantial. It tells her body that it is safe to be fully open. And a body that knows it is safe to be open is capable of experiencing a depth of pleasure that a self-conscious, defended body simply cannot access. Approaching intimacy with genuine presence and specific desire for her is not simply an emotional courtesy. It creates the neurological conditions under which her body can be fully responsive and fully capable of the depth of experience the encounter could offer. Translating all of this into practice means starting with pace. Initial penetration needs to be slow, not out of timidity, but because of how the body works. Even in a fully aroused woman, the vestibular bulbs and pelvic floor need the gradual progression of initial entry to communicate welcome and accommodation, rather than surprise or resistance. Beginning gently, entering shallowly at first and deepening gradually over the course of 1 to 3 minutes gives her body time to respond to each new increment with the appropriate neuromuscular relaxation and expanded arousal that allows the experience to build layered and continuous, rather than arriving as a single binary event. Beginning too fast, regardless of how aroused she appears, compresses a process designed to unfold in stages. That compression costs both people something real. The second thing she needs is genuine attention to what her body is communicating. Breath is the most reliable real-time signal available. Breath that deepens, slows, and finds a rhythm signals that arousal is building and the body is responding well. Breath that becomes shallow, held, or tense signals that something needs to slow down or adjust. Muscle responses throughout the pelvic floor, thighs, and abdomen carry the same information in physical terms. A woman who reaches toward her partner, draws him closer, moves to meet his rhythm, is communicating clearly that she is receiving what she needs. A woman who grows still, holds her breath, or creates subtle distance is communicating just as clearly that she needs a different pace, a different angle, or more time. Reading that communication requires only one thing, that a man's attention is actually directed outward toward her experience rather than inward toward his own sensations or his performance. When attention is genuinely outward, the information available is continuous, rich, and accurate. When it turns inward towards self-monitoring and evaluation, that access disappears entirely. Most men, especially in the intensity of the moment, are attending primarily to their own experience. The shift toward attending primarily to hers is the single most impactful change available in intimate life. And it becomes more rather than less accessible with age, because the urgency and performance anxiety that tends to narrow younger men's attention inward tends to ease over time, opening real space for the kind of outward attentiveness that produces genuinely connected intimacy. The third practical requirement is consistency at the right moment. Female orgasm depends on maintaining a specific stimulation pattern through the period approaching climax. The nerve pathways producing the building response lock into the rhythm, depth, angle, and pressure they are receiving. Any significant change in any of those variables during the final stages disrupts the pattern and can diminish or eliminate the orgasm that was building. When she communicates, verbally or through her body, that she is close, the only thing required is to maintain exactly what has been working without variation. Not faster, not with a new angle, not with added intensity. Simply the same consistent, attentive continuation of what was already building. Changing technique at precisely the moment when consistency is the only requirement is one of the most common and consequential mistakes in intimate life. The experience does not end with orgasm or with physical separation. The neurochemical state that intimacy produced continues to shape her experience for a meaningful period afterward, and the quality of presence in that period is directly relevant to what she carries away from the encounter. Oxytocin, elevated throughout the intimate experience, remains elevated in the period following climax. That window is the moment of greatest emotional openness and vulnerability in the entire encounter. It is also the period women most consistently describe as the one in which they feel most or least connected to their partner, depending entirely on how he is present. A man who remains close after intimacy, who does not immediately disengage, check his phone, or pivot to practical matters, who simply allows the warmth and closeness to continue for even a few unhurried minutes, is offering something neurochemically meaningful. He is telling her nervous system in the language it understands most clearly that she is safe, that the connection is real, and that she is not simply a means to a physical end. That message, delivered consistently over the course of a relationship, accumulates into a depth of trust and openness that shapes every intimate encounter that follows. The opposite is equally true. A man who withdraws immediately after intimacy, physically or emotionally, during the window when she is most primed for connection, sends a message her nervous system registers with the same clarity as any spoken word. Delivered consistently over time, that message teaches her body to protect itself from the vulnerability of full openness and creates a gradual closing that both partners can sense even if neither can name it. The capacity to remain present, still and warmly connected after intimacy without urgency or distraction is one of the areas where emotional maturity and lived experience create a genuine advantage. It is also, consistently, one of the qualities women identify as most important in a partner at this stage of life. Taken together, this is the full picture. Her experience of intimacy is physiologically, neurochemically, and psychologically layered. Her body requires a specific sequence of preparation before penetration can be fully pleasurable. The act of penetration itself activates the complete internal clitoral complex and produces an oxytocin surge that is amplified by genuine emotional safety and connection. Her vulnerability in that moment is real and consciously felt. Pace, attention, and consistency at the right moment are what her body and experience need from a partner. And presence that continues after the physical encounter honors the neurochemical state that intimacy has created and shapes every encounter that follows. The man who understands all of this is not managing a set of techniques. He is genuinely present with another person in one of the most neurologically and emotionally rich experiences two people can share. He is attending to her actual experience rather than to an imagined version of it. He is offering the kind of attuned care that produces the deep, cumulative intimacy that long partnerships are capable of, but that most couples never fully reach. That is what genuinely present intimate partnership can look like, not physical performance or elaborate method, but real physiological understanding, real emotional presence, and the specific attentiveness that allows a woman to be fully herself, fully open, and fully met in the moments that matter most to both of you. That combination, available to anyone who chooses to develop it, is what allows intimacy to deepen rather than diminish as the years pass. If something in this shifted your thinking or gave you language for something you already sensed but could not quite articulate, pass it on to someone who could use it.